MASLD affects nearly 38% of adults worldwide and can silently progress to steatohepatitis, fibrosis, cirrhosis, and liver-related events. Non-invasive liver stiffness measurement by vibration-controlled transient elastography has emerged as a practical alternative to biopsy for fibrosis assessment. A 3-tier system classifies patients as low risk below 8 kilopascals, intermediate between 8 and 12, and high risk above 12 kilopascals. Yet static cutoffs treat each measurement as a snapshot, and the dynamics of how patients transition between these categories remain poorly characterized. We set out to characterize these LSM risk transitions and to develop a time-updated, individualized model for predicting state changes and liver-related events or death. From the International VCTE Prognosis Cohort, we studied over 11,500 MASLD patients across 16 centers who had at least 2 VCTE assessments. Based on baseline liver stiffness, about 73% of patients were low risk, 16% intermediate, and 11% high risk. We applied a continuous time, multi-state Markov model to estimate annual transition probabilities and the average time spent in each liver stiffness state. Patients could move bidirectionally between adjacent states, with liver-related events or death as a single absorbing state from which no recovery occurs. The low-risk category was remarkably stable. 92% of patients remained unchanged after just 1 year. In sharp contrast, only 39% of intermediate-risk patients stayed put after 1 year. 45% regressed to low risk, and 16% progressed to high risk. Low-risk patients stayed an average of 8.4 years. The high-risk state lasted just over 2 years, and the intermediate state under a single year. By 5 years, more than 28% of intermediate-risk patients had progressed to high risk versus under 4% of those starting low. Type 2 diabetes, hypertension, and obesity each markedly shortened the time patients spent in the low-risk state and raised their risk of progression. For obese patients, low-risk occupancy collapsed from over 11 years to under 4, the steepest reduction of any factor we examined. Among patients with diabetes, SGLT2 inhibitors and GLP-1 receptor agonists were associated with more favorable, regression-oriented transition patterns. We then built Dynamo, a dynamic multi-state model that combines a patient's current liver stiffness state with key clinical variables. For a 50-year-old with intermediate risk, Dynamo predicts a 76% chance of regressing to low risk over 5 years, and revises that estimate as the patient's state or risk factors change. In short, liver stiffness strata are distinct, dynamic trajectories. The unstable intermediate state warrants closer monitoring, and Dynamo enables truly personalized surveillance in MASLD